So I'm going to start by coming and introducing myself to the patient. Hi, Esther. My name is Hannah. I'm going to be your nurse today. I saw that you had a colon resection. So I'm just going to do a baseline assessment on you, get everything we need to done. I'm going to close the curtain, give us some privacy, do some hand hygiene. Put some gloves on. Can I get your name and date of birth? Okay, and I'm just going to check that on your wrist. That is perfect. I'm going to do a safety check of the room, making sure her bed wheels are locked. I'm going to raise her bed to a comfortable height from you, which it already is. I'm going to sit her up a little bit though. Let's see. Okay. So, how have you been doing today? Not too good? What would you say your pain is on a scale from 1 to 10? 7? Well, that's not good. Hopefully we can help you be in a little less pain. I would take her vitals, and her blood pressure is 128/72, pulse was 78, respiratory 18, O2 is 99 on room air, and temp is 36.9 Celsius, so all of those are in good ranges. I would do Caldera, which is characteristics, onset, location, duration, exacerbation, radiation, relief, and associated symptoms, just asking her different questions about her pain. I'm going to ask her what her name is, if she knows who she is. Okay, perfect. Do you know who the president is? Perfect. Do you know what day it is? Perfect. And then, do you know what time it is? Okay. Do you know where you're at? Perfect. Okay, you're all good there. I'm going to check your eyes. So if you can just look at me, I'm just gonna check your pupils. Okay, perfect. They're looking good. And then I'm gonna have you follow the tip of this with your eyes, adjust your eyes. Perfect. Okay, I'm gonna check in your ears, make sure everything's good there. Say ah, check up your nose. Okay, everything's looking good. Can you smile for me? Okay, can you frown? No drooping of the face, her smile's even. I was assessing for mood while I was asking her questions to make sure to see if she would talk to me and what her mood is. Now we're gonna move on down to her chest. Have you been having any chest pain recently? Not really. Okay, that is good. Chest pain is no fun. And I'm just going to listen to your chest. Okay, try not to expose you. I'm looking at it, assessing for anything. We're gonna listen to 5 different points. We're gonna go aortic, and then pulmonic, down to Erb's point, and then we're gonna listen to tricuspid and mitral. And at mitral, we're gonna listen for a whole minute to get the PMI in your rate and rhythm. And your heart is sounding good, so that is good. You've been having any chest pain or cough or anything like that? Not too bad. Okay, I'm gonna watch you breathe, make sure you're not using any accessory muscles and that your breathing is good, which is good. I'm gonna listen to your different lung sounds. Hopefully my stethoscope is warm and not too cold on you. Listen on 6 different places, so you can just take a deep breath in and out. And go to the other side, same thing. Perfect, going a little lower. Perfect. Okay, another deep breath for me. Sounding good. Okay, I'm gonna have you lean forward for me so I can listen on your back. I'm gonna do 6 places on the back as well. Deep breaths in and out. Okay, everything's sounding good. Lay it back down. Okay, now I'm gonna take a look at your abdomen. Make sure everything's good there. sure I keep you covered. Okay. So it's looking okay. It's not distended or anything. And I'm going to be careful because I know that you've had some surgery. I'm just going to palpate it and tell me if there's any pain. Okay. It's okay. Not too bad. I'm going to listen for your bowel sounds in all 4 quadrants. Okay, those are sounding good. I'm going to ask, when was your last bowel movement? It was today. Okay. And having any troubles with that? You're able to get to the bathroom okay? And okay. And urinary, if you've been able, saw that you can't pee, so that's why we're putting a Foley catheter in. It's been kind of burning and stuff, so we'll get that taken care of. Just gonna assess your skin. So I'm gonna start with I'm gonna feel your face too, make sure. Okay, face feels good. I'm gonna assess your arms for any edema or swelling, which is good. Other arm. Okay. Going to check your cap refill. Less than 3 seconds. I'm going to check both of your pulses in your hands to make sure that they're equal, which is perfect. And I'm going to do it to your feet. So go like this. Feel your legs for edema or swelling. Just looking good. Okay, checking cap refill. Perfect. Check those pedal pulses, make sure that they're equal as well. And then I'm gonna have you push down on my hands. Okay, can you push your feet back up? Perfect. I'm gonna have you grip my hands. Perfect, good strength. Has your range of motion okay? Can you move your arms around? Okay, and you're able to get up and walk just fine. Okay, that is perfect, I'm so glad. I'm gonna check your turgor. Just pinch you real quick. Okay, it's looking good. And your skin is warm and dry and intact. You do have an IV here, which I noticed, but the skin around it is just fine. Didn't see any wounds or wound dressings, and you don't have a catheter yet, so we don't have to check any of those. Yeah, so I think you're doing pretty good. I'm gonna take off my gloves, perform hand hygiene. Do you have any questions for me about anything? And I did check, and it says you're allergic to Percocet, is that correct? Okay. And you're not taking any other drugs as of right now at home, but just acetaminophen for pain at the moment, okay? Do you have any past medical history I should know about? No? Okay. I'm gonna go get your medication ready. So, I'm gonna come out here. I'd make sure that my patient's bed was lowered so that she was safe in bed before I left the room. So from her, check your doctor's orders. She's ordered acetaminophen for pain and some potassium because her potassium is low. So I'm gonna get some hand hygiene and some gloves to get my medications ready. We're just gonna do one at a time. Start with the acetaminophen since she's in pain. So our acetaminophen, let's see what our order says. It's going to be 650 milligrams. So I'm going to check that with the medication I have, which this is 325, so we're going to do 2 of these. And we're going to do our 6 writes, 3 checks. So this is our first check. We have the right medication, the right patient, the right dose, which is 2, the right time, which is right now because she's in pain, and that's our reason as well. So I'm going to open these and put them into a cup without touching. Perfect. And I am going to take these in with me. I'm going to do my second check once I get in there. Make sure I have everything right. So So I'm gonna take all my things. Knock, knock. Close the curtain again. Make sure I have the right patient. So I'm going to check again now that I'm in here. We're doing acetaminophen for Miss Esther here for pain. We're going to do 650 milligrams, which is a great dose. Oh my goodness. My computer would load. Computer problems. Okay, I'm going to scan your barcode, make sure you got the right patient. Perfect. Okay, we're going to scan our medication. Perfect. Ooh. Now I'm just going to recheck everything for a third time and making sure that I have everything right, my patient, my medication, my dose, the time, the route, and the reasons. We're doing oral, and I'm gonna make sure she's sitting up so that she doesn't choke. Ask if she has any swallowing problems before I get this to her, if she needs to take one at a time or anything like that. I give her these, and then give her a drink of water. Perfect, swallowed those great. I watched her swallow, so now I can say that I administered those medications. Okay, so we got her acetaminophen for pain, and then we're going to get her potassium ready. Come back over here for potassium chloride. We're going to check that we have the right one. Perfect. And we need 10 MEQs, and this is 10. So we're gonna make sure we have the right thing, and this is for our patient because her potassium is low. This is not one open for me. Put it in our cup as well. Okay, and then I'm gonna come in the patient's room again and check it against my MAR, making sure I have the potassium chloride, 10 MEQs, it's oral, it's for Esther. Okay, I'm going to scan our medication barcode. And I would scan my patient's barcode again, but at the moment it doesn't want to. And if I had to do any patient teaching with this, I would. So we can always check and see on here what, if she's wondering like why she needs potassium, we can check. And it's to prevent hypokalemia, and this it's a safe dose for her. So I'm gonna check everything for a third time, making sure I have all the right things. Again, asking her if she's gonna have trouble swallowing. I'm gonna give her this pill, some water. She's sitting up, so she's all good. I watched her swallow, so I can document that she took it. And I would come back and check and see if this worked in about like a half hour, see if she's in any pain still. Take off my gloves, perform hand hygiene. Making sure that all of this is documented so we know when we gave her her medication. Okay, now we've given her medication. Awesome with that. Here. The doctor ordered a Foley catheter, so we're gonna get that ready. So, I have my care kit. I'm just gonna come in here. Knock, knock. Okay, I'm gonna do a Foley catheter, and I did give you some pain medicine earlier, so hopefully that's starting to kick in, and you're feeling okay. I'm gonna lay your bed back down flat. Whoa. Making sure I close the door behind me so she has privacy. Put the bed up a little higher because I'm tall. And we're gonna do some catheter, some hand hygiene, gloves, clean gloves for this one. I would explain what I'm doing because it's a scary procedure and it's not going to be painful, but it is going to be uncomfortable. So hopefully the pain pill I gave you earlier is helping, and this is going to help you feel so much better once we get all that urine out of your bladder. So I'm going to uncover her, keeping her decent though, just as much as I need. I'm going to try and put her legs out for me, just so it makes everything easier for us. We're going to clean. If it was really messy, we would do more cleaning, but she's good, so we're just gonna do one side. You get a different wipe or use a different part of this wipe. Do the other side, same thing, new wipe or a different part of this wipe, and going down the middle, making sure everything is clean. Throw that away. So that she's clean, I'm gonna take off these gloves, put on hand hygiene again, and I'm gonna get this opened, making sure she's good throughout all of this. Oh, there's not like this, is it? This is my sterile kit, so it's gonna be my sterile field. I'm probably gonna go like this for myself. Make it easier for myself. And I can touch this because it's the outside. Going to open away from me first, just the outer 1 inch of everything, making sure not to touch anything so everything stays sterile. Turn it. Okay, now I'm gonna come put my sterile gloves on over here where I can still see my sterile field, but I'm not in the way of anything. Grab this one. That is so fun. I don't like sterile gloves. None of my fingers want to go in, that's okay. We'll fix it on the other one. This one is not sterile. I'm gonna go under for this. Okay, I'm starting over. This is not going well. Different one. It's always good to be prepared and have true sterile gloves with you. A lot better. Going under the cuff. I can fix this hand. Okay. Make sure I'm gonna bring my sterile field. I don't need these. Going to get this out. Let it fall open. I'm gonna put this under my patient. She already has a check under her, so that's good. This is gonna be our other sterile field. I'm gonna go under, making sure not to touch anything, just getting it where I want it. And my other one, same thing, just letting it open. Put it over. Gonna get all of my supplies ready over here. I'd also ask if she had any allergies to iodine in particular, and she doesn't have any allergies other than Percocet, so she is good. Just getting everything ready for her. Put this in my lube. If it will open. That is so fun. Doesn't want to open. Make sure that we lube this generously because we don't want it to hurt going in. And get my flush ready. Make sure there's no air in there. Nothing on my stroke foot got wet, so it's still sterile. I'm gonna connect this to our port. Perfect. Get this open. Take that out. Move sterile fields, making sure to tell my patient not to move so she doesn't break my sterile field I just made. Going to use my one hand, and now this one is no longer sterile. We're going to clean. We're going to go down one side, throw it away, down the other side, making sure, throw it away, and then down the middle. Perfect. Okay, then we're going to get my catheter, which has been lubed, and I'm going to do this. Going to insert it. Take a deep breath. I'm gonna go, oh great, it doesn't want to go in. 2 to 3 inches until we see some urine, and then we go a little further. And then we're gonna hold it so it doesn't move. And we're gonna blow up her balloon. These ones only hold 5, so. Okay, and now it's in there, it's not gonna come out. So we no longer need to be sterile. We're going to get our bag, move this, and we are going to put this on the bed frame, not the side rail, so it doesn't get caught in anything. Perfect. And she has a catheter on her, so I'm gonna secure it for her. So we're just gonna go, this one is for the little one. And the big one. Okay, and get all of this. If we needed to clean anything else after, we would do that. Going to cover her up, make sure that she's not in any pain. And legs back down. Cover her up, make sure she's comfortable, give her her call light. I'm gonna clean up all my trash. Do hand hygiene one more time. Lower her bed so that she is to the ground, so she's safe. Ask her if she needs anything else, make sure she's comfortable, clean up all my trash, and then I would go document.